Alright guys, what's up? Average Joe's Nutrition back again. Today I'm going to be making another psoriasis guide video, and today we're going to be talking about some medication, either medication that you get from the doctor or dermatologist, whoever you're trying to go to. We'll be talking about the pros and cons of it and whether you should or shouldn't go and try and get medicine for yourself. So let's just get into it and let's get started. So the first thing I want to talk about is the pros and the cons of getting medicine from a dermatologist or a doctor to treat your psoriasis. A lot of people will disagree with dermatologists and doctors about medication for psoriasis. You'll see it all over the internet saying how this doesn't work and don't listen to your dermatologist, they're just lying to you, and the doctor doesn't know what he's talking about. And okay, granted, some of that may be the case. A lot of the times the dermatologist or whoever it may be, maybe just trying to make money or get you in for another visit, whatever it may be. But I do recommend that if you do have psoriasis, especially if you've had it for a long time and you're just now noticing it, that you do take a visit to the doctor or the dermatologist, because they're going to find out a lot more about your condition. And the medicine that I use is actually very helpful, and I'll talk about that in a minute. So I think it's well worth your visit, and it's well worth the time to at least go and try and check it out and see what they have to say. And you might need to go visit a few different dermatologists or doctors before you actually find a good one that fits you. Fortunately, I really do like my dermatologist. I go and see her every 6 months now, and I refill my prescriptions when I do that, or I ask different things if there's anything new that's coming out that will help me, or I ask questions that I have concerns with. So yeah, if you do have psoriasis, definitely go check a doctor out or a dermatologist and try and find someone that's suitable for you. I'm not saying that they're going to offer you the cure or anything like that, so just keep that in mind that they don't offer a cure, but they offer treatments or help. So yeah, do that for yourself. And I'm going to go over the pros and the cons now. The pros of medication, obviously the pro would be that it works, that you get a medication orally, topically, or whatever it may be, and it's working for you and it's helping your psoriasis. That's like the ultimate goal when you try and get a medication or you're trying to get on one. So that's the biggest pro, okay? Unfortunately, not every medication is going to work. So like I said, you're gonna have to test the waters and see what does or doesn't work. So that's the biggest pro we have up there, is that if it works. The next pro would be easier treatments. What do I mean by that? So instead of having to, I don't know, like for example, people on Humira, a lot of people have had super successful stories with the drug Humira. And so that would mean that you don't have to diet anymore, you don't have to go sun tanning anymore, or you don't have to use topical treatments. It'd just be cutting out an extra step that you have to do throughout your daily process. So that's what I mean by easier treatment, okay? The next one would be eliminated stuff. So like, it kind of goes hand in hand with the last subject, but you don't have to buy shirts or things like that to mask your cream, or you don't have to, you just don't have to do as much stuff. So that would be another pro. And unfortunately, I couldn't really think of any other pros other than that it works and that it eliminates or makes your schedule easier. Those are the only pros I could find. Yeah, that's all I can think of. Now let's talk about the cons of switching over and using medicines and things like that from the doctor. Obviously the biggest one is it doesn't work. You spend the time and the money to go see the doctor, and they give you a prescription, and you've been doing this medication for weeks now and it's still not working. Unfortunately, that might be the case, and you might just have to try another medication or try doing something different. A lot of the times that's the case with psoriasis. It's such a hard disease to pinpoint and to control that more than likely it might happen, so don't be discouraged. More treatment, okay? Obviously, if you're still doing things like diet and sun tanning and other things that you do throughout your day, and now you have to add on medication, that kind of sucks, it really does. It's an extra step in your day. It's an extra 10-15 minutes before you go to work or before you go to bed, and now it's like you have to think, okay, how am I going to do this, blah blah blah. I mean, it sucks, it does. Then obviously side effects. If you guys saw my last video, you guys saw my stretch marks. That's definitely a side effect of the medicine that I'm using. A lot of other medicine, such as oral medicine, will have a bunch of different side effects that are more drastic, such as Humira, I know, increases your chance of getting infections and cancer, things like that, blah, blah, blah. I'm not going to get into that, but side effects are a big concern when using medicine, especially oral medicine. Not so much tropical, but oral is definitely a higher risk. And then acne and stretch marks, as I put up there. I've noticed with a lot of the medication out there that you do get a lot of acne in the spots that you apply it to, and stretch marks. Almost any topical treatment that you use, the idea is to stretch out your skin, and that's expanding and contracting your skin, blah, blah, blah. So you're getting stretch marks on your skin, basically. You guys saw that in my last video. If you haven't, look up the video, what my psoriasis looks like, and you'll see my stretch marks on my sides, and I'll explain that a little bit later. Oh, makes it worse. I couldn't even read that. So yeah, some treatments that I did try a shampoo one time that, oh my god, it made my psoriasis look terrible. So you gotta be careful, okay? Some of the things that a doctor will give you, they don't know what they're doing, and they'll just give it to you because that's what it says on the computer, and it's gonna make your psoriasis more inflamed, it's gonna make it itchy, so you gotta be careful. But it's hard to be careful when you need to try something to see if it works, but if you do see something making your psoriasis work, stop doing it right away. That's my opinion of it. Just stop doing it, okay? So that's the pros and the cons of using medication. And now I'm actually going to go over with you guys what my medication is and how I use it and my thoughts on it. So let's do that. So the first medication I have is like a topical treatment. It's like a greasy kind of treatment thing. I don't know if you guys can see that. Again, I got this from my dermatologist, and it's called triamcinolone, okay? Hopefully you guys can kind of, here's a better label. Hopefully you guys can kind of see that label and read it for yourselves. I'm not sure if you can, okay? What this stuff is like, it's a really greasy treatment stuff, and you just spread it on your skin in the area where your psoriasis is. Okay, if you can see the greasy, it's like petroleum jelly. This stuff works good. It really does. I bought it a bunch. This is like a 1 pound tub, and it cost me maybe 25 bucks, 30 bucks for a tub. And right now this tub has lasted me over 4 or 5 months, okay? And I'm still only halfway through it. This stuff is great because it reduces my inflammation, which in a later video I'm going to show you guys how that really is effective. So it reduces my inflammation, okay? Great stuff for doing that. That's the pro of it. So yes, it does work. The con of it is that it gives me stretch marks. And in the beginning I used way too much of it, so it really stretched out my skin. But now I use it in very small increments, only when I need to, maybe every other day before I go to bed, okay? But it does work, so keep in mind that it's one of those ones that does work. I'm going to add on that when I'm using that medication, I highly recommend, if you're using something like that, to get like 4 or 5 shirts that you don't care about, because, and I don't know if you guys will be able to see this, but yeah, it's kind of hard to see. You'll kind of see on the sides where it's darker, okay? That's because the grease has seeped through the shirt and pretty much stained it, okay? So you're going to need a few shirts at night that you're going to need that will pretty much just be your sleeping medicine shirts. And then when I go to work, if I need to put it on before work, I just get like a plain white tee, like an undershirt, okay? This one's fairly new, so it's not very trashed. And I just put it underneath my shirt, okay? Like an undershirt. And that works great. So that's how you can use it at home and how you can use it at work. And it honestly takes away the itching like you wouldn't believe. I mean, the reason I started using it is because one night I was just itching so bad that I had to put it on, and then next day I could just see the reduced inflammation. So really great stuff. One more time for you guys to see that, okay, if you can. My next one is going to be a hair product or scalp psoriasis treatment. And again, this stuff is great, okay? Very tiny little droplets that you would do, okay, you see that? this has lasted me for about 4, 5, 6 months now, and I still got a lot left. But pretty much this stuff is great for the scalp. You just barely rub it in, and the next day or two, the inflammation is completely gone, scales are completely gone. It does, again, it's going to thin out your skin, but it's really great stuff, okay? I can't complain about this. It's really easy to use. It takes maybe a minute to put in my hair. And like I said, the next day or two, it's completely dried up or gone. And yeah, stuff is great to use, so keep that in mind. And I don't really think it's that harmful on the scalp itself. But I have noticed that some of my hair has been starting to thin out in some areas, and I think that might be the only con, but it's very slowly doing it. So keep that in mind, keep a close eye on that. And again, don't use too much of this stuff at one time because you will get an acne breakout. The first time I used this, I put a bunch of it on and my scalp was just broken out with acne and it sucked. It was almost worse than the psoriasis. So there's that one again for you guys, okay? Really great stuff. Highly recommend asking for that if you have some scalp psoriasis that you're trying to get rid of. So that's it for my medication that I use. I know there's a lot more medication out there and I just haven't used it, so I'm not even going to talk about it. The only other medication that I would recommend for people is Humira. While there is a lot of side effects and risks, I think that it's a good drug and I think that it helps a lot. And I think if you maintain your health and you watch the side effects, that it can be a very cooperative drug. So keep that in mind. You have the scalp psoriasis treatment and you also have the skin psoriasis treatment. And then obviously Humira if you have really bad plaque psoriasis or arthritis psoriasis. So pretty much guys, that's it for this video. I'm trying to think of something else I can throw in there. Definitely make sure you have some shirts. Definitely make sure that you have some cleaning supplies and stuff like that. And definitely develop a routine. Throw it on in the beginning of the day, the middle of the day, or at night before you go to sleep. Things like that are really going to help you maintain that, the treatment. And the last thing I do want to add, when you combine all these treatments, okay, for example, the diet, I'm going to do another treatment video that's going to be my last one. I'm going to show you guys what my psoriasis looks like. So if you combine the diet, the medication, and tanning, and any other thing that you can do, it really, really helps you out. I mean, my psoriasis is almost gone at this point. It's only been a month since I've restarted my treatments. So just keep in mind that combining all of them is the way to do it. I don't do the treatments as much as I used to, which is nice, okay? So you get less and less reliant on the medication and the treatments and more reliant on just living every day. So keep that in mind, okay? The more and more you do everything together, the less and less you have to do of it all at one time, okay? So yeah, guys, that's it. As always, follow me on Facebook, Average Joe's Nutrition. Just type it in, find me, whatever you gotta do. Subscribe to my page. I'm gonna come out with a lot more entertaining videos and things like that. If you have any questions, please send me a message or an email, something like that. And just always share my videos, guys. The more coverage I get, the more people I can reach to actually help. And that's pretty much it, guys. Good luck with your psoriasis. Good luck with nutrition. Follow me, message me, whatever you gotta do. Share me. I love you guys. Have a good day and good luck.